The Bachelor of Arts in Public Administration program is at the University of Hawaiʻi-West, Oʻahu. And that degree really prepares students for supervisory and management roles in the public sector. Students get a solid foundation on the practices and processes of understanding pretty much public sector management from an array of programs and concentrations. Those concentrations include community health, disaster preparedness and emergency management, healthcare administration, long-term care, justice administration, and general public administration. We actually also have certificate programs in disaster preparedness and emergency management and healthcare administration. For the public administration degree as a whole, you'll see listed on the screen there are several courses that are required in the degree as a whole. Introductory courses in the concentration of the student's choice, research methods, communication skills, administrative decision-making skills are all kind of courses geared towards helping students to develop their leadership and their ability to work in management sectors. Students will take 18 credits or 6 courses specific to their concentration as well. The contact person is Dr. Christina Liu. She's a chair in the Division of Public Administration and a professor in healthcare admin. I'll move now to several of our other concentrations, including community health. Dr. Spencer will speak about long-term care, and I will also highlight healthcare administration as a concentration. But before that, let me give you a quick outlook on jobs in Hawaii. There are approximately 92 health-related careers. We often talk to high school students, and they are just blown away by how many different health careers are out there for them to choose. In the US, there are over 1 million healthcare jobs, and given all that's going on with COVID-19, we know that these jobs are on the uptick. Healthcare unemployment rates seem to be relatively low, as everyone is always in need of medical attention. I share with my students that it's very wise for them to choose careers that aren't going anywhere. One of those careers that isn't going anywhere is a career in healthcare. The healthcare industry is one of the fastest growing in our economy, and it's estimated to grow by at least 19%, if not more, in a couple of years. And for many, healthcare jobs are both enjoyable and even rewarding. So why PUBA? Why a major in this program? Well, at West Oʻahu, we want to provide opportunities for families of size of 4 to have at least a sustainable living wage, and that's kind of estimated to be at $78,000. And we also have the great opportunity of seamlessly transferring students from high school and community colleges into bachelor's degrees and then on to master's and doctoral level degrees. I actually have a student who graduated from community health who's now pursuing her graduate studies in nursing, and she really attributes being a part of the community health program to her success in her program now. We promote innovation and we strive for excellence in this major. So the program that I actually am the faculty contact for is the community health program at West Oʻahu. In this program, we're actually designing or preparing students to have a diverse set of skills in community engagement, community health, education and promotion, community action research. It's really timely for this degree right now. I'm teaching courses to community members for COVID-19 to become contact tracers, and it's one of the first times that I'm very happy to say that this program has real relevance in our society. We're also preparing students to work as patient navigators, nurses, aides, community liaisons, community health educators, outreach workers who also can plan, implement, and evaluate health programs. Some of the really key courses that are involved in this concentration include community health analysis, one of the kind of integral courses to this program. We teach epidemiology, which is really fascinating. Last term, as I taught the class, I gave real-time examples of how we could track COVID-19 in our state. We teach cultural competency in healthcare in this program, which also kind of highlights some of the other concentrations that we have as well. Teaching from a lens of understanding and empathy of healthcare for others. Program planning and evaluation to analyze and assess programs. Of course, foundations and how we understand health behavior, and obviously a capstone project for students. This program is online, especially now that we are somewhat staying at home. It's very important that students have the ability to access their coursework online, and we'll be doing that this term. Again, I'm the faculty contact for the community health program, and you can see my contact information listed on the screen there. I will now transfer over the slides to Dr. Lisa Spencer.
Okay, thanks, Dr. C. So again, I am Lisa Spencer, and I am the faculty contact for long-term care. Next slide, please. So when Dr. Camonia was talking, all of these concentrations require that you take the courses in public administration. There are required courses there, and those are required in order for you to get a bachelor's degree in public administration and in one of our concentrations. So Dr. Camonia talked about community health. I'm going to talk about two other programs we have in healthcare, long-term care management and healthcare administration. So our long-term care management concentration is fairly new. We are seeing an increase in the amount of older people living longer, as well as an increase in the amount of people needing long-term care and long-term care services. We're also seeing a lot of people retiring out, which means that our healthcare industry will see a lot more available positions as the seasoned professionals are retiring out. So the long-term care concentration focuses on the long-term needs of Hawaii's aging population and the growth in demand for long-term care providers, paraprofessionals, and skilled workers in administrative capacities. Now, one of the things about these programs is that while we prepare you to be a manager or an administrator, it really gives you skills to work in any administrative position across the healthcare environment. We know that while we do have a specific area called long-term care, we know that we will see our older population in any healthcare environment, whether it's acute care in a clinic, in a same-day surgery, maybe in a retail clinic. So knowing about our elderly and the issues that they may face with their health might be, is necessary. So some of the courses that we offer in this concentration might be useful when you decide, well, I don't want to work in long-term care, but I want to work in community health, or I want to work in the hospital. You may need some of these skills to work with our older population. So we'll talk about long-term care, we'll look at some financial concepts, we'll look at managing the long-term care environment, we'll learn about our older population, and like all courses, you do need to do a capstone. This concentration is available only in distance education modality, which means if you want a degree in the long-term care concentration, these major courses you can take online. You can take some of the electives at the campus, but the majority of the courses are available or will be available online. And on this slide is my contact information at Hawaiʻi-West Oʻahu. Next slide, please. I'll talk a little bit about our healthcare administration program. Next slide, please. As Dr. C said, we offer this both as a concentration as well as a certificate. So this degree is designed to further your understanding about healthcare in general, as well as looking at some of the healthcare challenges and coming up with some solutions. We provide students with essential skills and knowledge to work as healthcare administrators, in hospitals, ambulatory care centers, and community-based facilities. We focus on supervisory, management, and leadership roles in this growing healthcare field. And so some of the areas that we focus on in this degree program or concentration, administration, policy, finance. We look at managed care, which is where healthcare is going. We look at ethics and being able to treat our patients as well as our coworkers and our employees properly. We talk about disaster management. And then again, there is a practicum for this concentration as well. Like community health, this is available both in traditional face-to-face as well as distance education modalities. And the contact person for this degree program is Dr. Susan Young, and here is her information on this slide as well. So something just to kind of remember, no matter which of these fields you want to go into, you do need to take both public administration courses as well as courses in the concentration of your choice. Dr. C?
Okay, we actually have given you the information that we'd like to share with you this morning, and we want to hear from those who are on the line now. Might anyone have any questions about attending UH-West Oʻahu, some of the programs that we've shared with you, or anything of those sorts? And I guess Robin or Dana might be able to see the chat.
Sure, so we have some questions coming in. Could you provide some examples of the starting salaries in the jobs you've referred to?
Oh, sure. I'll begin and then I'll pass to Dr. Spencer. In community health here in Hawaii, we've seen starting salaries for entry-level positions, which include even patient navigators, even healthcare educators, even in community settings, as high as $55,000 starting. The salaries, of course, go up as education goes up, and we've seen master's level students can start anywhere from 65 on up with their degree. Lisa?
I did want to just say one thing related to healthcare admin and long-term care. These are management positions and degrees, and they're non-clinical. So a lot of times when students are looking to go into a clinical program like nursing or med tech or they would get their degree that way. What we're doing is we're preparing you to go more into management. So we expect to see, 50 to 60,000. We also expect though to have the need for some experience prior to applying for some of these degrees. So you may see yourself coming out with a bachelor's and you would work in maybe an entry level position and work your way up into the company or in the company to a management position. And at that point, then you can make, the high 80s, 90s. And then in long-term care, a long-term care administrator can make, over $100,000 a year. And that takes a little bit more training than just that bachelor's degree, because they do require certifications and licensing.
Great, thank you. We have additional questions coming in. Could you speak to what it would look like? So for a student who's coming with a community college degree, the example given was an AS in nursing. How does that student then add to that degree?
So I'll start. I have some examples of students who have done just that. And maybe, hopefully I can address this. I know of a student who came in Capulani with some credits. And so I always recommend that students first go to our website and check out all of the degree offerings that are associated with the degree in public administration. And from there, kind of read each description for each one of the programs, and then really take a look at what is offered on the right-hand side of the screen. And I probably can do it now. We have, screen sharing has stopped. On our website, we actually have the opportunity for students to check out what's listed on our program sheets. And so if I were a student who was just getting ready to come to West Oahu, I would definitely go to our UH West Oahu homepage, as you could see on the screen here. And really what speaks to me as far as a student who might be interested in a program are these program sheets. And so these program sheets will be updated with the 20 to 21 academic year. And these serve as useful tools for students to see the actual classes that are offered in public administration, and then down to the specific courses that are offered in the concentration. And for me, I think it's very important for students to try to get an understanding for the courses that they've already taken, for example, at a community college, and then speak with an advisor, speak with UH West Oahu admissions on which courses might transfer or have some equivalency. And so I will say for community health, our 104 Introduction to Community Health class, it's often something that a nursing student would have already taken. And so that might be something that a student can get credit for, or any other electives. Lisa, do you want to add anything?
I did want to add one thing about the difference between our concentrations and our certificates. So a student that might be coming out of a community college, if they're interested in getting a bachelor's, then they would look at maybe a PUBA degree in community health, long-term care, healthcare admin. But if you're interested in just specific courses, you could come in and not really looking for a degree, maybe a certificate. You could do that in our healthcare administration. I think the question is really good because what it does is it helps us look at what opportunities are available beyond. So like this student who got her degree in nursing. So you can go into nursing administration. And so the healthcare admin program would be great for you. If you wanted to work in a long-term care facility, perhaps being the director of nursing, you might want to look at a long-term care concentration. With COVID-19, you want to work for Department of Health and perhaps hold a supervisory position. You might want to look at the community health concentration. So, your nursing is a great background to have, or baseline, and then you work up towards supervisory or management by getting a degree from UH West Oahu.
Thank you. We have a couple of different questions coming in about internship opportunities. Could you address a little bit what would be available to students in your programs?
Sure. I can speak specifically to the community health program and generally to PUBA. We actually have a really great way of helping students to kind of navigate that internship process. We have, I believe, Dr. Anita Tanner still works with helping students to solidify and identify internships. I mean, I think we have what is almost like a manual of different types of internships that are available. One that really speaks to our public administration students as a whole is our partnership with Queens West. And I've personally attended some of those capstone presentations and find that the students get a lot of opportunities actually seeing the administrative side of what happens in the hospital, as well as getting really good experience in their particular divisions. For community health, we have a connection with the behavioral health side of the hospital. And I'll also share, but because community health is online generally for most students, we do the capstone, which is a written type of culminating project where students can write about a specific research project or problem and address it as they would as a community health professional. But again, we do have several contacts, specifically the American Heart Association with community health, Waianae Coast Comprehensive Center with community health, and Queens West. Lisa?
Yep. And I think we, in most of our internship facilities, we can do many different things. So you can work in administration, you can work in clinical, you can work in the community. So there's a lot of different choices. I think something that Dr. C said that was good, you actually have the option to either work in a facility or do a research paper. So whichever you feel, or when you work with your faculty, feel that would best help you in your future, that's the choice that you'll make. And then we will try to place you or give you several options in the area you might be interested in. So whether it's in long-term care, acute care, working for the state government, working for private enterprise, we have a lot of options there for you.
Thank you. I'll ask one more question on behalf of our participants before we wrap up. And I think, Dr. Spencer, you may have just started to address it. This is specific to practicum. What type of help is offered to your students with placements for the practicum?
So like Dr. C said, we have a long list of different organizations, and each organization gave us a paragraph or two about the different opportunities that they have. So we try to get you in touch with the organization that you are most interested in, or at least interested in maybe pursuing a specific department or specific project. But really it's student driven. So we monitor you, but it's you working with the organization and, coming up with a project or coming up with day-to-day activities. And then depending on the avenue you choose, you will either write a journal entries weekly, and we'll monitor that. Or like I said, you can do the research paper, and there'll be no contact with an organization in that way. But we work closely with your practicum site to make sure that you're getting the best experience, as well as the organization is getting the best experience. Because sometimes a student might think that this is a great place for them to work, and then they just don't click. So then we'll go ahead and try to find you another option so that we can make that practical experience as fruitful or nourishing as possible. Because a lot of times, you get a lot of book work and a lot of classroom work. And so these practicums are really your opportunity to work out in the field. Another thing, and this might be off of the question, but another thing that a lot of us faculty do is we really recommend that our students, if they're able to do volunteer work while they're in the degree program. Because what you might think you like when you come into the program, you may learn that, wow, I like this part of the job, or I want to do this. And so, the volunteering becomes very important as well.
Thank you so much. You mentioned relevance earlier. You and your programs are critically relevant now more than ever. We really appreciate the information you've shared today. For the participants, thank you for joining us. Please share this information out if you're a counselor with students, and if you're a student yourself, with your peers. Thank you again to Dr. Graham-Tutt and Dr. Spencer for their time with us today. Mahalo nui.
Thank you.
Mahalo.